Hey everyone, and welcome back for another deep dive with us. Today we're going to be looking at dependent and histrionic personality disorders.
Yeah, these are some interesting ones for sure.
They really are. And, our jumping off point for this is going to be a chapter from a psych textbook.
Right. A pretty dense chapter, too, I have to say. I mean, we're going to do our best to break it down into something a little more digestible.
Yeah, exactly. I think everyone has at least heard of these disorders,
No, for sure, for sure.
but they kind of get thrown around, as insults sometimes. And so I think it'll be good to really unpack what these disorders actually are.
Absolutely. And, it's not just about labeling people, but it's really about understanding, the complexity of human behavior.
Exactly.
Hmm.
So, should we start with dependent personality disorder?
Yeah, let's do it.
Okay. So you know how sometimes you might avoid rocking the boat in a relationship,
Mm.
not wanting to cause conflict.
Yeah, of course, we all do that, I think.
Totally. But imagine that, but amplified tenfold.
Oh,
Yeah. So the text describes people with dependent personality disorder as having this deep-seated fear of losing support,
right.
to the point where it dictates their every move. And actually the DSM lists difficulty disagreeing as a key diagnostic criteria for this.
Yeah, and it goes even deeper than that. The text talks about people with this disorder going to extreme lengths to please others.
Oh, wow.
Even if it means doing things they find unpleasant,
Oh, wow.
really highlights how much their need for support overshadows their other desires.
It's almost like they're trapped in the cycle of needing reassurance and then doing whatever it takes to get it.
Yeah, exactly.
And that makes me think about what the text was saying about this disorder being more common in people who are chronically ill as kids.
Hmm.
Could that early experience of needing constant care
Hmm.
kind of create this pattern that continues into adulthood?
It's a really interesting theory for sure. Imagine being a child and constantly needing to rely on others for your well-being. I mean, that could definitely shape how you see yourself and your ability to handle things on your own.
So it's not just being clingy, like you might hear people say.
Right.
There could be this deeper psychological thing happening.
Absolutely. And while we don't know for sure what causes dependent personality disorder, it's probably some mix of nature and nurture.
Okay.
And the text mentions overprotective or really strict parenting could play a role too.
That makes sense. If you're constantly being told what to do or your parents are anticipating your every need,
Yeah,
you might never learn to make choices on your own.
exactly. And that kind of parenting can almost accidentally send the message that you're incapable of handling things yourself.
Oh, wow. So you're robbing them of the chance to develop their own independence.
Basically, yeah.
So how do you help someone who's stuck in this pattern? I was surprised the text said short-term therapy was best.
Yeah.
I would have thought it'd take years to undo something so ingrained.
Well, that's where it gets kind of counterintuitive. The text actually says long-term therapy could be bad for this disorder.
Really? Why?
Well, think about it. Someone with this disorder is constantly seeking reassurance, right? So years of therapy could make them rely even more on an authority figure.
Ah, that makes sense. So it's more about giving them the tools to break free.
Exactly. The text really highlights how effective it is to address the root of the problem, their thoughts and emotions.
So instead of giving them a crutch, you're teaching them to walk on their own.
Exactly.
Wow, treating personality disorders is complicated.
Oh, yeah, for sure. And we've only just scratched the surface. Now, ready to switch gears to something that might seem completely opposite.
Oh, yeah, bring it on. Histrionic Personality Disorder. This is the one that's all about the drama, right?
Well, it's part of this group called Cluster B personality disorders.
Oscar B.
Yeah, it's a way of grouping personality disorders that have certain traits in common. So histrionic personality disorder fits in because it's marked by super intense emotions and attention seeking.
And that shows up in really specific ways, right? The text mentioned feeling uncomfortable when they're not the center of attention
Mm-hmm.
and using their appearance to get attention.
Exactly. And it's more than just wanting attention. It's they need it to feel good about themselves.
It's almost like they're saying, hey, look at me. I need you to see me so I know I exist.
Yeah, something like that.
And the text pointed out this other interesting thing. They overestimate how close they are to people.
Right. You ever met someone who thinks they're best friends with everyone they meet?
Oh, yeah, definitely.
Well, in this case, it's not just being friendly. It's an issue with boundaries and understanding real intimacy.
Oh, I see.
And that can cause a lot of problems in relationships.
So it's not just being dramatic on the surface.
Nope.
There's actually a lot of vulnerability underneath.
Exactly. And that's something really important to keep in mind when we talk about treatment, which we'll get to later.
Okay, but before we do that, I
Yeah.
have to ask. The text said histrionic personality disorder is relatively common,
It is.
like 2 to 3% of people.
Yeah, that's pretty common.
Any idea why that is?
It's a question researchers are still working on. The text does mention a possible link to childhood trauma,
Okay.
but just to be clear, that doesn't mean everyone with the disorder experienced trauma.
Right, right. It's not a simple cause and effect.
Exactly. And another thing is, the way we diagnose this disorder might not be the whole story.
Okay.
Clinically, it's diagnosed more in women, but research shows men and women might just express the symptoms differently.
Oh, so there could be like a gender bias in how it gets diagnosed?
Yeah, that's a possibility.
Wow, that's an important thing to keep in mind.
It is. It reminds us that how we understand these disorders is constantly evolving.
True. And that brings us back to the whole nature versus nurture thing. The text says the exact cause of histrionic personality disorder is unknown, but it's likely a mix of genetics and environment, just like with dependent personality disorder.
Mm-hmm. And here's where things get really interesting.
Okay.
The text gives two different viewpoints. On one hand, there's the idea that it's learned, like a child copying a parent with the disorder.
So they learn that being dramatic gets them what they want.
Exactly.
Oh.
But then there's the psychoanalytic perspective.
Okay.
This digs into early childhood experiences and those unconscious conflicts we talked about before.
Ooh, that's where it gets really interesting. Tell me more.
Okay, so the psychoanalytic view says that if a child keeps trying to get attention but doesn't get it in a healthy way, they might develop these histrionic behaviors to cope.
Oh, so it's like they're trying to fill a void.
Yeah, exactly.
Yeah.
Trying to get the validation and love they're craving.
And the text specifically mentioned this theory about early childhood experiences with the mother.
Right, right. Some theorists believe if a child feels rejected by their mother early on, they might develop this huge fear of being abandoned and just need to be seen and loved.
So all that dramatic stuff is a way to protect themselves from being rejected.
Exactly. It's way more complex than just being attention hungry.
This is making me rethink everything I thought I knew about histrionic personality disorder.
That's what I love about these deep dives. We're always learning and challenging our assumptions.
I agree. But before we go too far,
Yeah.
let's talk treatment. The text said therapy for this disorder can take years. Why is that?
Well, remember, we're dealing with parts of someone's personality.
Yeah.
It takes time to untangle those patterns and develop healthier ways of thinking and acting. Plus, the text said people with this disorder tend to leave therapy early.
I can see that. I mean, if you thrive on excitement, therapy can feel kind of boring.
Yeah, that's definitely part of it. And they might also be scared to face those deeper issues.
So they need therapy to heal,
Right.
but their disorder makes it hard to actually do the work.
Exactly. It's a real catch-22.
Okay, well, we've only got so much time today.
We do.
So let's pick this up in the next part of our deep dive. We'll talk about the specific treatment approaches for both of these disorders.
That sounds great. I'm looking forward to it.
Yeah, me too. See you next time, everyone.
See ya. Okay, so picking up where we left off
Yep.
with treatment approaches,
Mm.
I think it's really important to highlight something the text said about diagnosing dependent personality disorder.
Okay.
Like we talked about the criteria, but the text was very specific about the fears.
Oh, yeah, the fear of being alone.
Right, those fears have to be like over the top and unrealistic.
So, like, we all need people,
Yeah, for sure.
but it's different for someone with this disorder.
Exactly. It's not just about feeling a little insecure or needing some reassurance. These fears, like, control their lives.
Wow, so even small decisions are dictated by those fears.
Right. And we also need to be careful not to mix up dependent personality disorder with other similar ones.
Like what?
Well, both dependent and borderline personality disorder involve being afraid of abandonment, but they look really different.
Oh, that's interesting.
Yeah, so someone with borderline personality disorder might react to being abandoned with, like, intense anger or even, like, self-destructive behaviors.
Okay.
Whereas someone with dependent personality disorder is more likely to try and please the other person, be super submissive.
So they're doing whatever they can to hold onto that connection.
Exactly. They'll avoid conflict or disagreement at all costs.
It's like they're constantly walking on eggshells.
And that fear can affect all their relationships, romantic ones, friendships, even at work.
Yeah, this stuff really can impact someone's whole life.
It really does.
It makes you realize how important it is to get the diagnosis right.
It is. It's not about putting a label on someone.
Mhm.
It's about really understanding their experience and what's going to help.
Speaking of help, let's dig into those treatment approaches for a dependent personality disorder.
All right.
We talked about short-term therapy being the go-to.
Yeah, and that's because, like we said before, long-term therapy could actually backfire and make them more dependent.
So it's about giving them the skills to be more independent.
Exactly. The text emphasized looking at their thoughts and feelings.
Yeah, can you explain that for everyone listening?
Sure. So in cognitive therapy, the focus is on challenging those negative thoughts and beliefs that feed into their dependence.
Okay.
So, like, they might think, I can't do anything right by myself,
Right.
or I need someone to tell me what to do all the time.
Oh, wow. I can see how that would become a self-fulfilling prophecy.
Totally. If you believe you're incapable, you're not even going to try.
Yeah, you're just going to give up.
Exactly. So cognitive therapy helps them identify those negative thoughts and start to believe something more realistic and helpful.
But it's not just thoughts, right?
Nope,
Yeah.
definitely not. We have to address those feelings that are tied to those beliefs. Those feelings of helplessness, the fear of being alone, the anxiety about making decisions.
Yeah, all of it.
All of it needs to be acknowledged, processed, and challenged.
It's like breaking down those emotional barriers to independence.
That's a great way to put it.
And I bet assertiveness training can really help with that.
Absolutely. Assertiveness training is all about learning to communicate your needs and boundaries in a healthy way.
So it's like finding a balance between being passive and aggressive.
Exactly. It's about advocating for yourself while still respecting others.
So it's not about being confrontational?
No, not at all. It's about saying no when you need to
Okay.
and asking for what you want without being afraid of rejection.
This would be so helpful for someone who's always trying to please everyone.
Yeah, it can be life-changing. It helps them find their voice and put their own well-being first.
Now, the text also talked about group therapy for dependent personality disorder and how it can be both good and bad.
Right, so group therapy can be amazing.
Hmm.
It can provide a safe space to practice those new skills and get feedback from people who get it.
So it's like a community of support.
Exactly. But we have to make sure the group dynamic doesn't accidentally make them more dependent.
So the therapist needs to be really careful.
Exactly. It's
Yeah.
about finding that sweet spot between support and encouragement to be independent.
Now, on top of group therapy, the text also said it's super important to look at any unhealthy relationships that might be fueling the dependent behavior.
Yeah, I mean, sometimes people with dependent personality disorder are in relationships that just perpetuate those unhealthy patterns.
Okay.
They might be with someone who's controlling or who takes advantage of their need to please.
So it's about helping them see those unhealthy dynamics
Right.
and making choices that are good for them, even if it means ending the relationship.
Exactly. They deserve to be in relationships that are built on respect and healthy boundaries.
Okay, we've covered a lot about dependent personality disorder.
We have.
Let's switch gears to histrionic personality disorder.
Right.
The text said therapy for this one can be a long and difficult process, often using a mix of different approaches.
It is. Remember, we're dealing with ingrained patterns here, often rooted in early childhood experiences and stuff we're not even aware of. So it takes time and effort to unravel those patterns and find healthier ways to cope.
And the text mentioned how people with this disorder tend to leave therapy early.
You do.
Is that because they're always looking for excitement and novelty?
Yeah, that's part of it. They might get bored or scared to face those deeper emotions.
So they might even try to charm the therapist to avoid doing the hard work.
It's like they're always looking for that quick fix on the outside instead of doing the work on the inside.
And that makes treatment really hard.
It does, but not impossible. One approach the text mentioned was psychoanalytic therapy.
Oh yeah, we touched on the psychoanalytic perspective before.
We did.
But what does that look like in therapy?
So psychoanalytic therapy tries to uncover those unconscious conflicts and patterns that are making the person crave attention and act dramatically.
Okay.
It's about looking back at childhood experiences and seeing how they're affecting the person now in their relationships and behaviors.
Like we're tracing those threads back to where they began.
Yeah, exactly. And through that process of self-discovery, they can start to develop healthier ways of coping and relating to others.
But that sounds like it could be pretty intense emotionally.
It can be. That's why having a skilled and experienced therapist is so important. Someone who can guide them through those tough emotions in a way that promotes healing.
And the text also mentions something called psychodynamic therapy, which is a type of psychoanalytic therapy, right?
It is.
And it needs to target those underlying conflicts and help the patient be less emotionally reactive.
Exactly. It's not enough to just understand those past experiences.
Right.
They also have to learn to manage their intense emotions in a healthier way.
So it's like learning to surf those emotional waves without getting wiped out.
That's a great analogy. It's about finding that inner stability.
So we have that deeper work.
Right.
But are there more practical approaches too, like cognitive behavioral therapy? I know we talked about that for dependent personality disorder.
Oh, yeah, CBT can be super helpful for histrionic personality disorder, too. Yeah, it helps them challenge those distorted thoughts and beliefs that are making them act impulsively and react dramatically.
Can you give an example?
Sure. So they might think, I need to be the center of attention to be loved.
Yeah.
Or, if I'm not getting attention, I'm worthless.
Ouch, those are tough beliefs to have.
They are. So CBT helps them see things more realistically, like, my worth doesn't depend on how much attention I get.
Right.
Or, I'm valuable even if I'm not being admired.
So it's like rewriting their internal dialogue.
Exactly. And CBT also helps them recognize and change those impulsive behaviors.
So instead of always interrupting, they
Yeah.
might learn to pause and actually listen.
Exactly. They can learn to set boundaries, communicate their needs, and handle their emotions without all the drama.
So it's about giving them the tools to handle those tricky situations.
Yep. And the text also brought up relaxation training.
Oh, that seems weird for someone who loves excitement, right?
It might seem that way, but relaxation techniques can be a game changer for managing anxiety and reducing impulsive urges.
So they learn to calm themselves down.
Exactly. It's about regulating their nervous system so they're not always on edge and reactive.
And they can find that sense of calm from within.
Right, instead of always needing it from the outside.
That makes a lot of sense. Now, the text also talked about group therapy for this disorder.
Yeah, and as you can imagine, it can be both helpful and challenging.
Yeah, I can see that.
So the good thing is, it gives them a safe space to practice those social skills.
Mhm.
They get feedback, and they can challenge those unhelpful beliefs about themselves and relationships.
It's like a real-life testing ground for those new skills.
Exactly. And it can be really validating to share their experiences with others who get it.
Right, you're not alone.
Exactly. But of course, there are challenges too. Someone with this disorder might feel threatened if they're not the center of attention.
Oh, yeah, that makes sense.
So the therapist really needs to carefully choose who's in the group and set clear boundaries.
So it's not about letting them keep being the center of attention.
Right. It's about helping them learn to interact in a way that's balanced and respectful of everyone.
And the text mentioned using psychodrama in group therapy. What is that?
Psychodrama uses role-playing and drama techniques to help people work through their emotions.
Oh, okay.
So in the group, they might act out a situation where they're trying to be the center of attention.
Oh, so they can see how their behavior affects others.
Exactly. And by taking on different roles, they can develop empathy.
They can literally see themselves from someone else's perspective.
Right, which can be a really powerful experience.
Now, I know we talked about family therapy before, but I'm curious how it applies to histrionic personality disorder.
Oh, it can be really helpful for this disorder too.
Okay, how so?
Family therapy can help the whole family understand the disorder and learn better ways to interact.
Right.
The text mentioned using behavioral contracts, especially for dealing with tantrums.
So setting clear boundaries and expectations for behavior.
Exactly. It's about rewarding those positive behaviors and discouraging the dramatic outbursts.
And the whole family works together to support the person with the disorder.
Right. It's about creating a more stable and loving environment where they can express themselves in a healthy way.
Sounds like family therapy can really help shift those unhealthy patterns.
It can. But everyone in the family has to be on board and committed to making those changes.
That's important. But even with all these treatment options, the text wasn't very optimistic about the chances of someone with histrionic personality disorder fully recovering.
Yeah, and that's because, personality disorders are persistent.
Right.
And changing those patterns takes a lot of work and a willingness to face those deep-seated fears and insecurities, which can be tough.
And as we've been saying, people with this disorder often leave therapy too early.
Yeah, which makes it even harder to make those lasting changes.
So it's a challenge,
It is.
but not impossible, right?
Definitely not. With the right therapist and support, people can learn to manage their symptoms and live really fulfilling lives.
Yeah, and it's important to remember that recovery is a process, not a one-time thing.
Right, there will be ups and downs.
But every step forward is a win.
Absolutely. And it's a reminder that we need to be patient and compassionate with people who have personality disorders.
Well said. Okay, well, I think we've covered a ton of ground today.
Well,
We've really gotten into the details of dependent and histrionic personality disorders, from how they're diagnosed to what might cause them to all the different treatment options.
and we talked about those complex theories and how they play out in real life.
Plus, we emphasized how important it is to be understanding and tailor treatment to each person.
But the deep dive isn't over yet. In the next part, we're going to explore the treatment landscape even more, looking at specific techniques and strategies that have shown promise in helping people with these disorders.
So stay tuned, everyone. We'll be right back to continue our exploration. Okay, so we're back, ready to dive into those specific treatment approaches.
All right, let's do it.
I'm really curious about the techniques used in psychoanalytic therapy for histrionic personality disorder.
Yeah, it's pretty unique, isn't it? Like, while other therapies focus on changing thoughts and behaviors, psychoanalytic therapy really digs into those unconscious patterns and early experiences that might be driving that need for attention.
So it's like getting to the root of the problem.
Exactly. One technique they use is called transference.
Transference, okay.
Have you ever noticed how you might react to someone in a way that just seems out of whack? Like maybe you get super angry at a coworker who kind of reminds you of like a critical parent or something?
Oh yeah, totally. It's like those old relationships are playing out in the present.
That's transference. And in therapy, the patient might do that with the therapist, but unconsciously.
Oh, so they might start seeing the therapist as like a neglectful parent or something.
Exactly. And by really paying attention to those interactions, the therapist can help the patient understand those deep-seated patterns.
So they can see how those patterns are messing up their relationships now.
Right. It's like holding up a mirror to those unconscious dynamics.
Wow, that's powerful. But it seems like it would take a lot of trust for the patient to be that open.
Oh, absolutely. That's why the relationship between the patient and the therapist is so important in psychoanalytic therapy.
Yeah.
The therapist has to create a safe and supportive space so the patient feels comfortable enough to be really honest and explore those deep emotions.
Like a sanctuary for healing.
I like that. And it's important to remember this type of therapy is a long process.
It's not a quick fix.
Definitely not. It takes patience and a willingness to face some uncomfortable truths about yourself.
And we talked about how people with this disorder tend to quit therapy early.
Yeah.
So how do you deal with that in psychoanalytic therapy?
Well, the therapist has to be really good at spotting those patterns and tackling them head on.
Okay.
They might help the patient understand WHY, they're resistant to therapy, what are they afraid of?
Yeah, like intimacy or vulnerability.
Exactly. And ultimately help them commit to the process, even when it's tough.
So they learn to stick with it even when it's uncomfortable.
Yeah, because ultimately it leads to more freedom and well-being.
That makes sense. But psychoanalytic therapy isn't the only option for histrionic personality disorder, right? The text also talked about cognitive behavioral therapy.
It did, and CBT can be really helpful for this disorder, too.
We talked about it for dependent personality disorder.
Yeah.
So how does it apply to histrionic personality disorder?
Well, let's say someone with this disorder is always looking for attention and validation from others.
Mm-hmm.
They might think, if I'm not the center of attention, I'm not lovable.
Oof, that's got to be tough.
Yeah, or I need people to admire me to feel good about myself.
It's no wonder they're always trying to get attention.
Exactly. So CBT helps them challenge those beliefs
Okay.
and replace them with more realistic thoughts like, my worth doesn't come from how much attention I get.
Right, that's so important.
Or I can feel good about myself even if I'm not being admired.
So it's like rewiring their brain to not need that constant validation.
Exactly. And CBT also helps them recognize and change those impulsive behaviors that come from those distorted thoughts.
So instead of always trying to take over the conversation,
Right.
they learn to pause and actually listen to others.
Exactly. They can learn to set boundaries, communicate assertively, and handle their emotions without all the drama.
It's like giving them a whole new set of tools for dealing with difficult situations.
Yeah. And the text even talked about using relaxation techniques in CBT.
Really? That seems strange for someone who's always seeking stimulation.
It does. But someone who's constantly looking for attention is probably in a constant state of stress.
That makes sense.
Their nervous system is in overdrive, so relaxation techniques help them calm down and regulate their emotions.
So they can find peace and quiet within themselves.
Exactly. And the more they practice, the better they get at handling those intense emotions and not giving in to those urges to seek attention.
So they're not relying on external things to feel good.
Right. They find that fulfillment from within.
Now, what about group therapy for histrionic personality disorder?
Group therapy. It can be really valuable, but it definitely has its challenges.
Yeah, I can see how that can be cricket.
It's a great way to practice social skills and get feedback in a safe environment. It's also super validating to share your experiences with people who understand what you're going through.
Right, you're not alone in this.
Exactly. But for someone with this disorder, it can be tough if they're not the center of attention.
Yeah, that makes
They
sense.
might feel threatened or try to compete with other group members.
So the therapist really needs to be on top of things.
Oh, yeah, absolutely.
Yeah.
They need to choose the group members carefully, set clear boundaries, and manage those dynamics so everyone feels safe and respected.
So it's about creating a space where they can learn healthy interaction.
Exactly. It's not about letting them dominate or be the center of attention.
Right.
It's about helping them learn to listen, be supportive, and connect with others in a genuine way.
And the text talked about using psychodrama techniques in group therapy. What's that all about?
Psychodrama uses role-playing to explore and process emotions.
Oh, interesting.
So in group therapy, they might role-play a situation where they're trying to be the center of attention.
Oh, so they can see how it makes other people feel.
Right. It helps them develop empathy and see themselves from a different perspective.
Like they're stepping outside of their own little world.
Exactly. And that can be a real turning point for them.
And the text also talked about family therapy for this disorder.
Yeah, family therapy can be really helpful for histrionic personality disorder.
Okay, in what way?
It helps the whole family understand what's going on
Right.
and find ways to interact that are healthier.
Okay.
For example, they might use behavioral contracts to encourage the person to be more assertive instead of throwing tantrums.
So it's about setting clear expectations for behavior.
Exactly. It creates a more stable environment where they can express their needs in a healthy way, and the family can support them in that.
But even with all these different treatment options, the text wasn't too hopeful about people with this disorder fully recovering.
Yeah, and that's tough. It's because, these are long-standing patterns that are hard to change.
They're ingrained.
And it takes a lot of work and self-awareness to shift those patterns.
Plus, they might leave therapy early.
Right, which makes it even harder.
So it's a challenge for sure.
It is, but definitely not impossible.
Yeah.
With the right support and a good therapist, people can learn to manage their symptoms and have fulfilling lives.
It's about finding the right fit.
Absolutely. And remember, recovery is a process, not an event.
It's a journey.
It is. And we need to be patient and compassionate with people who are on that journey.
Well said. I think we've covered a ton of ground on dependent and histrionic personality disorders today.
We have.
We talked about the details of what these disorders are, what might cause them, and all sorts of different treatment approaches.
Yeah, we really got into the nitty-gritty of those theories and how they play out in real life.
And most importantly, we talked about the importance of understanding and tailoring treatment to each person's unique needs.
Absolutely. Because remember, everyone's experience is different.
Thanks for joining us for this deep dive. We hope you learned something new and maybe even challenged some of your assumptions about these